So if you guys would like a copy of this program, you're more than welcome to grab one. Please feel free to send an email, info@naturalalignments.com. So we'll have a video guide of the sequence that I'm going to give you for yoga today. As well, we can do virtual osteopathic assessments. I'm happy to do that. Osteopaths actually aren't allowed to work in this particular lockdown. So I am doing virtual assessments for free for anyone who would be interested. If there's something that you're working on, whether it be shoulders, neck, or back, or if you're not sure if your work setup is good for you, then maybe what you'd want to do is have an assessment done where we could position your computer so I could see how you're sitting at your desk. So I'd be happy to do that for you, complimentary. One or the other or both, whatever it is that you'd like. So Natural Alignments is a wellness center and it's located at 1 Prologis Boulevard. So we're likely in your complex because this is the Mississauga Gateway community. And if you'd like to come in and see us at any time, you're more than welcome to. The majority of our services are considered to be essential. So if there's something that you need, then we're open and hopefully meet you as soon as this lockdown's over. So the 5 most common desk injuries, we're going to focus on areas rather than calling them a pathology. For example, we're going to be focusing on areas of our body that tend to create a lot of strain, or they suffer with a lot of strain if our desk setup isn't correct. Further to that, if we are just sitting, we could have the perfect desk setup, but we are just sitting for a really long period of time, then over time our body will start to develop tensions, and even if we are in the perfect position. So there are things that we might want to do to help to alleviate tension to give us more longevity in the day. So first of all, we're going to get into neck tension. So we're going to take a look at that. Headaches. So maybe we suffer with chronic headaches throughout the day. Maybe we suffer with jaw tension. Maybe we suffer with jaw tension into the evening and into our sleep. And it actually, as we sleep, we might teeth grind, we might tense our jaws, and that actually might be perpetuated by some tension that we're creating throughout the day. So we'll get into that a little bit. We're also going to talk about numbness in fingers and shoulder pain. So sometimes we end up with pain in the back of our shoulder and the front of our shoulder, and sometimes we end up with numbness and tingling down into our fingers. We'll talk a little bit about that. Then we're going to get into forearm and carpal tunnel pain. So if you've ever suffered with carpal tunnel, so just in the base of the wrist, we're going to get into the why that happens and some movements we can do to help to alleviate strain there too. Then we're going to focus in on our lower back. So we're going into why we might get pain and tension in our lower back and our hips. And then we're going to land in our knee and feet. Sometimes people deal with plantar fasciitis or issues with their feet and they don't really understand where it's coming from. It actually might be coming from your desk setup. Same thing with knee pain. If we suffer with chronic knee pain, it could be the position that we're sitting in throughout the day. So very excited to talk to you about that. And then at the end, we'll be doing a sequence, a yoga sequence, a rather quick one that you'll be able to do throughout the day that hopefully will alleviate some of these patterns that we're going to be talking a little bit more about. And again, any questions come up because any of this pertains specifically to you, you're more than welcome to fire me a quick email and I'd be happy to jump on a call with you, info@naturalalignments.com. But we'll chat about that towards the end as well. So first of all, let's take a look at how this person is sitting at their desk. So, or at their, I guess they're at their couch, right? So we can see what we should not be doing here. So this is just somebody who's casually working on their laptop, perhaps trying to get a project finished. And you can see, I'll take my cursor here so you can see the position of their back. You can see the position of their knees. You can see the position of their feet. Their laptop is on their lap. So they're looking down at their laptop. So a lot of this motion here that this person's displaying to us, we can really see over periods of time throughout the day, start to create contraction and actually can perpetuate the problem. We have to remember that our brain and our spinal cord are by far the priority in our body. So all of these muscles, the ones that run down through your spinal column, they're there to protect the nerves. And they actually get little signals when things, so we're starting from the base, looking right at the spine, they actually get little signals when you're sitting asymmetrically. So when we're sitting in a kind of a hunched over position, or we're sitting in a position, maybe you have one hand on our elbow. I know I like to sit at my desk like that while I'm working, or if we tend to create a cross-legged position while we're sitting, the muscles that surround the spine actually get little signals saying, hey guys, we have to come into contraction mode because we really don't want to have the nerves triggered or disrupted throughout the day. So they create almost like a little protective system, like a cast that helps to hold all of the tissue stable so that we don't compress that valuable tissue, the nervous system. So the spine first is the priority, and then all the muscles will start to adjust to take pressure off of some of the areas that are feeling too much pressure. And all of this is being done without your control. So your body's not necessarily sending you a signal while you're trying to get that project done. Instead, it'll just adapt to your position, and it'll do what it can to help to make sure that structure is not being compressed. Nerves, veins, arteries, lymphatic system, they are the priority in the body. So your body will just do whatever it can to help to adjust. The problem is, if we're hours on end like that, our body doesn't necessarily get the memo that it's time to let go later on. When we're up and we're like, okay, we're done our day, and we start moving around, because it's been holding for so long, it may or may not let go. And what's more is that the following day you come back into the same position, and we create the same position, and so on and so on. And we do this days on end. And our body just starts to train itself that this is the pattern that we're going to be in. So it has to contract in this pattern to protect us. So if we start to look specifically at the head, neck, and jaw, then we can start to see, so we'll see this picture here, this image, and this is a lot of us. I know me too, especially when I'm getting tired. I'm trying to lean forward because I really want to see what's going on in the monitor there, or so I'm reading a text. And I have to be able to squint that way. So leaning forward just a little bit too much. So you can take a look at his upper back through here. So you can see how his shoulders are sitting forward. You can see how his thoracic spine, so your upper back is called your thoracic spine. So all of this section here is sitting forward. You can look at the base of his neck. You can see that that's strained forward. So all of these muscles that are in here, because we're not sitting symmetrically, instead he's straining, those muscles have to come into contraction just to keep him aligned and upright so that his body doesn't actually start to compress some of that valuable tissue we're talking about. And again, coming back to day upon day upon day, or hour upon hour, us creating these patterns, your body will react by just instinctively knowing that it needs to hold in this pattern, which actually might be perpetuating your headaches, for example. So if we go here, this is an anatomy slide. If we go here, I picked this one because I wanted to show you what it looks like. So on the left, you can see some of this, the blue vein here. Your veins are not actually blue. We made those jokes when we were studying anatomy and physiology. Your veins are not blue, your lymphatics are not green. But anyway, that was an anatomy funny joke, haha. Anyway, so back over here, taking a look at this, you can see a lot of neurovasculature that runs down in and around the muscle tissue and through your neck. So if our neck is straining forward, and it's, imagine ourselves in neutral, where all of that neurovasculature is able to move freely, especially veins and arteries are able to move fluid freely. We go from this position to this position, we start to see, yes, all of these muscles will start to cause contraction, which in turn will actually have an impact on the movement of fluid. Further to that, all of this movement here and this tension might actually have an impact on some of the nerves that run in and around underneath and through layers of some of these muscles. And looking over here on the right, you can see the bony structure of your cervical spine. So up here, this is the base of your cranium here, and these are all your cervical vertebrae through here. And then these are all the ligaments that hold your neck in alignment. But again, because we strain, patients will be coming in with an anterior head posture like this, creating this anterior neck posture. And these vertebrae aren't able to move the way they're designed to. Your cervical vertebrae, so everyone, I'd love for you to try this now. So wherever you're sitting, but your cervical vertebrae, cervicals meaning from the base of your skull to C7. So right here at the top, sometimes you can really feel it if you feel at the back of your neck. You can feel one of them kind of protruding outward. That's usually right in around the base of your cervical spine, the top of your thoracics. Those guys are responsible for flexion, extension, side bending, and rotation. They kind of do everything, your cervical spine, because they're meant to be able to allow your head to look in every direction. So if you want to now, just stay nice and seated upright, nice and straight, drop your head down and see, do you feel tension as you start to drop your head down? Good, come on, back up. And I'm gonna have you look up, but not overextending your neck, because we know there's a lot of very important neurovasculature back there. Instead, I'd like you to look up, but to where the ceiling meets the wall. Good. How does that feel for you? Come all the way back to neutral. Turn your head towards the right. See if you feel freedom of motion. Turn your head towards the left. How do you feel there? See if there's a difference one side to the other. There often is, and it's quite telling. Dropping your right ear to your right shoulder. Come back up to neutral. Left ear to left shoulder. Come back up to neutral. So just observing on your body, did you feel a change in range of motion? Did you feel inflexibility on one side, perhaps more flexibility on the other? Did you not feel anything at all? Maybe you feel quite neutral in that space. But it's a really important tell, as we were saying, the muscles that go around the spine, they might be holding based on patterns you're creating. So headaches, we speak to headaches. We know that it has a lot to do with the lack of range of motion in these cervicals because of sitting or looking at our computer screen or straining for long periods, creating muscle contraction, which we can see over here. A lot of these muscles will get really, really tight and in turn not allow for cervical range of motion, which might have an impact on our blood supply or might actually be compressing some of the nerves in through here too. So that's a really important one. And jaw tension, we spoke briefly about, but a lot of people suffer with tight jaws at night. They might clench their jaw, they might teeth grind. There's lots of different reasons for that, but one of the reasons might be a psychosomatic response. So throughout the day, if we're really tight and we're trying to get a project done and our neck and the jaw tension starting to accumulate because we can see these muscles through here and it's been doing that all day long, we don't always get the memo that we need to let go of these muscles as we proceed through the night, and we're holding on to that tension right into our sleep. And then we're waking up throughout the night with a tight jaw, or in the morning we have a tight jaw as well. So part of the reason for that could be a psychosomatic reaction on top of other issues too. Okay, so moving into numbness in fingers and shoulder pain. So you guys are kind of getting the idea here. As an osteopathic manual therapist, we're all about functional anatomy. So it's looking at the but whys behind the reasons here. So yes, you might come in with numb fingers, but then we're looking at but why would your fingers be feeling numb? Because they shouldn't be. So why should they be? Why are they? And so that's when we start to explore. So here we are looking at someone else's posture. He has a great chair. He has one of the kneeling chairs here. He's not using it though. But anyway, so you can see that he's sitting in a hunched forward posture, a little different than the previous picture. But this one, you can see a lot of these vertebrae, again, are sitting in a forward posture, creating a lot of tension to hold him upright. You can see right into the shoulders. See how his shoulders are sitting anterior like this. His elbow position as well is sitting in kind of a contracted pattern. So he's not sitting level. His shoulders are not level. His thoracic spine is not in neutral, and his elbows are not at neutral either. So I'm going to pop right over to the anatomy, because this one's a really interesting one too. So the nerves actually come off of your neck. This is really important for us to know. So focusing on shoulder pain and tingling and numbness, then we have to know too, where do the nerves come from? They come from the back of your neck. It's called your brachial plexus. They travel all the way down, which is really interesting. The nerves travel down and they actually come underneath your clavicle. And if you want to take your hands, you can palpate your clavicle. It's your collarbone. Actually, if you lift your arm up and down, you'll be able to feel your clavicle. So that's a collarbone basically sitting through here. And underneath it is how the brachial plexus travels. And it goes under your armpit. It's called your axilla. So it goes underneath your armpit and travels down through your arm and then into your hands. And then the veins and arteries take this similar path down from the neck, all the way down through underneath the clavicle, through that axilla, through the armpit, all the way down and through the arms. And it travels blood supply right to your fingers and removal blood all the way back up. So knowing that your neurovasculature takes that pathway down through the arm, and that gentleman there was sitting with an anterior posture, his shoulders are sitting forward like this, then it's no wonder that he starts to feel shoulder pain or that he starts to feel numbness and tingling in his fingers, because all of this pressure is coming down onto the anterior aspect of his shoulder where all the neurovasculature goes. So one of the things we want to be really mindful of, and this is so many of us, because a lot of people, if you think about it, have jobs where they're leaning forward. If you're a nurse or a doctor, you're leaning forward. If you're sitting at a computer desk, you're leaning forward. An osteopath or a physiotherapist, some of the therapists, we're all leaning forward working on our patients. So the majority of us are spending the majority of our time hunched forward. Very few jobs or daily activities will have you in extension. I have a friend, he is also a patient, he's a painter. So I'm like, you might be the only exception I can think of where his arms are up and he's painting all day. But aside from that, we do tend to want to do this throughout the day. So we have to be very mindful of creating these contractions where we're able to open up through our thoracics, the back of our thoracics, as well as through the interospect of our shoulder, through our clavicle, to make space for some of this neurovasculature. All right, moving on to carpal tunnel. This is a really interesting one too. So when we think about carpal tunnel, again, these are different pathologies. They're called pathologies. So people coming in complaining of, you know, I have wrist pain, I have the numbness, the tingling, the burning sensations potentially in the wrist. People are explaining that, and we have to, again, dig a little deeper. So yes, you might have a problem with that nerve at that point, but why is there a problem there? So where is it coming from? And we'll look at this person here. So he's the way that he's sitting, a little bit of a straighter spine, but again, he's sitting collapsed back into his chair. His head posture, you can see there, is forward. And we know the brachial plexus, there's a test on this after, guys. I'm going to test you, just kidding. But the brachial plexus, we know, comes from the base of your neck, right? Remember how it travels from the base of your neck, underneath your arm, all the way down into your fingers. Well, look what's happening with his neck. So it's causing that anterior pressure, which is causing a contraction, which in turn has an impact of how these nerves are going to travel all the way down and through the arm and through the wrist. And then look at his elbow. So rather than his elbow sit in neutral, it's actually sitting at a bend. It sounds kind of funny because you might be very comfortable sitting at your desk this way or any way that's not neutral, but your body is responding differently. So as much as psychologically it feels comfortable to be in this pattern because you've been creating a pattern for a period of time, your body responds by holding these postures. So his elbow here is creating contraction, all of these muscles surrounding that section, creating those contractions, which are allowing him to continue to sit this way. Might be really comfy for his lower back too. That might be why he's doing that. And then we take a look here at his wrist, and we can see that because he's not sitting in neutral, his wrist is also creating some contraction. So this is likely, this section here is likely all the way up into here, why this gentleman is suffering with carpal tunnel or the compression on the carpal joint. So what does that mean? If you've had it before, you certainly likely know a little bit more about it. You've probably studied it a bit. But it really does hurt. It's not a very comfortable feeling, and it's usually right in the wrist. Could be in the side of the hand too, not carpal tunnel, but other wrist-related symptoms associated with the same type of postures. But looking here, so on the left-hand side, that's again where the brachial plexus comes out. There's a big nerve we have to think about when it comes to carpal tunnel. We'll call him the median nerve. So the median nerve actually travels down. My arm is out this way. It travels down all the way into my middle of my hand and up towards my thumb. So that median nerve actually controls all of the muscles associated with this section of my hand. And then we have the ulnar nerve, which is just beneath it. So it travels, same idea, down, and it goes into a lot of the muscles associated with the bottom of my hand. And we know that our forearm is able to pronate and supinate. So it's able to go back and forth. We can keep our arm nice and straight. So how about we all do this? Let's raise our left arms to shoulder height. We can put our hand right on our crease of our elbow here, and we'll give the camera a high five. Okay, good. So we're all facing the same way. And then let's just drop our thumb down. Good. And let's turn our hand back up. Now you can feel your forearm. These bones actually shift over top of one another, your radius and your ulna. Good. And they shift one over the top of the other. You can feel that right into the wrist. So what might start to happen if we're sitting in strange postures throughout the day is, again, those muscles that are in between those two bones and in around our elbows might actually prevent range of motion and our body's ability for the supination and pronation movements, which in turn might upset the blood supply, but also might tick off some of the nerves. We'll look specifically right here in the wrist. So you can see on the left-hand side there, the median nerve. We'll hone into this picture here. And you have a lot of this ligamentous tissue that hold all the tendons in place and keep all the nerves nice and secure. And one of those big fascial tendons, right underneath that, where all the tendons run for all of the movements of your fingers, is your median nerve. So here, we'll take another look. So these guys are tendons, they control muscles, but underneath here, that's your median nerve. What'll start to happen if we're sitting in these postures, again, muscles get really tight and it actually pulls on that tissue in the wrist, which in turn has a really big impact on ticking off the nerve. So you can see that. So coming back to it, so thinking about the anatomy of the elbow, the forearm, and actually even slides prior, the shoulder, the neck, the back, it's constantly important that we continue to open up through our shoulders and through our arms. But now we're starting to get a really clear picture how it's so important. I'm going to back up a little bit. If we're sitting at our desk, that we're sitting as neutral as possible. So again, rather than have our arms in a position where we're typing this way, creating a bend in our elbow, or sometimes we're at our desk and our desk might be too high for us, so we have our elbows on our desk like this, or maybe we're at the dining room table right now. We have to know that if we're not sitting in neutral, muscles just continue to contract. So we really do need to be in a position where our shoulders and our elbows are 90 degrees, and we're able to keep our hands in a nice flat platform. Again, might have been a little easier at your office desk when you had an adjustable desk or whatever. Maybe you're lucky enough to have gotten one for your home. I think they're in scarce supply. But if you are able to set yourself up in a position where we're able to keep our upper back and our upper body straight, our neck straight, so bringing your monitor closer rather than lean forward, then that'll be very helpful for the neck, the nerve roots, right? We spoke to that, the nerve roots, and then keeping our shoulders in alignment so we're able to be at 90 degrees, and then also keeping our wrists in alignment too. So, okay, lower back. So I think a lot of us are suffering with lower back pain these days too. And interestingly enough, a lot of times it's our lower back pain or our back pain generally, which kind of leads us to fall into patterns that feel more comfortable. So looking at this lady here, you can see she's sitting in a position where she's supporting her weight with her upper back, potentially to take pressure off of her lower back. Either way, she's actually got a pretty decent chair, but she's not sitting in it correctly. So she's sitting here and it's not supporting her lower back. And further to that, you can see here her knees. Her knees are not from her hip to her knee. That is not a 90-degree angle. So there will be strain in her lower back, absolutely, as her knees are not sitting adjacent. They're not sitting at 90 degrees. It's kind of creating a downward pull. So let's have a look here. So on the right-hand side, this is our lumbar spine. So let's take a look. So we spoke about our cervical spine. We started talking a little bit about our thoracic spine. That's our middle back. So from the base of your neck right up until your lumbars start. So if you want to actually take your hands, you can feel where your 12th rib is. So you can feel your ribs. You have your ribs right here, your xiphoid process. You can kind of follow your ribs all the way around to the bottom of your rib cage, and then draw a line straight back. Around in there is the beginning of your lumbar spine. Just a little bit up from that, but that's around where the lumbar spine starts, goes right down into your hips, right down to your sacrum, because your sacrum becomes part of your hip. So if you want to, what you can actually feel right now is feel yourself coming into flexion and extension. Your lumbar spine, so we spoke about your cervicals are responsible for flexion, extension, rotation, and side bending. Lumbars are a little bit different. Their sole purpose, this is what they do, is flexion extension. They have a little bit of side bending and rotation, but they're actually engineered. They look kind of like little shelves because their transverse processes are pretty straight. So their job is flexion and extension, flexion and extension. So we really do need to ensure that we're not stuck where they prefer flexion or not stuck where they prefer extension, or flexion or extension. So we want to make sure that they have a decent amount of both flexion and extension. So feel free to do a pelvic rock like I was just doing now. So sitting up nice and straight, tipping your pelvis forward, and then coming into flexion. Good, extension and flexion. All right. Good stuff. So feel free to feel that. So we can take a look here when we're sitting up in neutral. So this person here is sitting in a nice straight line. We can see that his pelvis is creating a bit of an anterior arch. So his lumbars are sitting in neutral. Your lower back naturally has a little bit of an anterior arch. It naturally wants to sit with a little bit of an anterior arch. We don't want it to be too exaggerated. So for example, say we love to wear high heels in the daytime. If we love to wear high heels, and I'm 34 weeks pregnant, so you weren't going to see a whole lot of movement here in my back. But if we're wearing high heels, for example, well, actually in pregnancy too, but it tends to want to pull your lower back into extension. So we might be overdoing our extension. Heels, any kind of an anterior pressure, pulling the lumbars forward. Also, we saw from the image in the previous slide of the woman who really loved to sit back, slumped into her chair. That's a flexion. So our body might respond by continuing to hold that flexion pattern as well. So it is quite important that we allow ourselves freedom of range of motion in the lumbars. On the left here, let's take a look at this hip. So we can see there's the nerves that come off of the spine. The nerves come off in pairs right from the base of your cranium all the way down. And here's your sacrum here, all the way down to your sacrum. So they come off the spine, from the spinal cord, they come off the vertebrae themselves, like underneath the vertebrae, and then they innervate with organs and they innervate with muscles. So that's kind of what they do down here. But you can see when we're sitting, if you can envision, we're sitting in a position that's asymmetrical. So we're creating a flexion or an extension. We tend to create compression sometimes on some of these nerves. This is your sciatic nerve here. So we've all maybe heard of that nerve. If we've ever had sciatic pain, you might know how that feels. If you haven't, good, I'm glad, but it does really hurt. And it actually tends to cause a problem right in through the glutes, all the way down into the leg, because this is a really big nerve here, but it actually innervates with a lot of the tissue that controls the leg. So this nerve can get ticked off kind of easily, depending on the muscle tension in the hip. Some of the muscles that surround some of these joints here can get really tight really easily. And in turn, that actually perpetuates some tension on the nerve. But also we come back to, if you're sitting in these postures where you're over-exaggerated flexion or over-exaggerated extension, it can actually compress the nerve roots through here too. So, all right. Last one to talk about, because I want to make sure we can get some yoga in here too. Knee and foot pain. Often, not a lot of people recognize that knee and foot pain can actually be caused by your desk setup. So I actually recently, everyone had a patient coming in, he's like, I don't understand what's wrong with my knee. I love to run. And then when we got looking at his posture, we started to recognize, yeah, but it's actually coming from your hip. The immobility in your hip is actually having a huge impact on your knee function. Your knee is a pretty simple joint in a way, mechanically speaking anyway, in that it does one thing, flexion, or so two things, I guess, flexion and extension. It's like a hinge, right? Like a hinge on a door. It either extends or it flexes. That's it. It doesn't rotate sideways. It literally flexes and extends. That's it. Same thing with your ankle. It's a little more complex. Your ankle joint has circumduction, right? So we know that our ankle is available to do circumduction. So it can flex, it can extend, it can rotate, because it has a whole bunch of little bones in your ankle that allow for range of motion, and that allows your body to move. What gets really interesting though is sometimes our knees can get really angry when your knee is being forced to do too much motion that it's not available to do. I don't know if that makes any sense. I don't know if I said that correctly, but for example, let's just say you're that person who's sitting at your desk, and let's just say you like to cross your leg one over the other. So you're sitting at your desk with a crossed leg. I know a lot of people do. Or, and this is me actually, and I'm guilty when I'm seeing patients, sometimes I got into a habit where I would sit on a foot while I'm on my table and chatting with my patient, or at the desk. So I'd cross a foot underneath because it's really comfortable. So I'd sit with that foot underneath and I would just chat with my patient, and I'd be working on a patient file. Perhaps I'd even put the file on my knee and I'd work while I'm talking to them about what's going on with them. But I'm creating a motion at the hip, where I'm creating a pattern. So by sitting on a knee or crossing a leg, I'm holding, or my body's starting to hold that pattern that we were talking about. It's not yelling at you because it feels comfortable, because I've done it so many times for so many years, or for long periods of time. I've created these patterns. So my muscles start to get really tight in these patterns. And then I go to stand up, and now I want to, let's just say I want to go for a run. So now I'm going to go for a run, but my hip is so tight, and my hip is the one that's responsible for a lot of range of motion. So it should be able to create better range of motion. This is a ball and socket joint. So say, for example, I'm running and I want to turn to the right when I'm running. If my hip does not want to move, then that range of motion has to come from either my back or it's pushed into my knee and sometimes into my ankle. So if my knee, for example, is being asked to do range of motion outside of its scope, for example, it's creating too much pressure onto the right side or the left side, then it actually starts to irritate the tissue because it's not its job, right? So it starts to complain that it's having to work outside of its scope. So we'll just pop forward so you can get a better look. This is the knee right here. So you have your femur. So if you want to grab your knee, everybody take a look at your knee. You have your femur. Your femur is this big bone here, the big top bone here. And then you have your patella, you can see there, a little tiny cap that sits on top. And then you have two bones in your leg. You have your tibia, that's your shin bone. If you ever played soccer, you probably know what it is to get kicked in the shin if you ever have. So you have the shin bone here. And then you have a little bone beside your shin bone here. It's called your fibula. So you have two bones in the bottom of the leg, one bone on the top of the leg. They come together to make that knee joint. And a lot of times, if you've ever suffered, you played sports maybe growing up, you maybe suffered with a strain. An ACL is the famous ACL tear that we all hope we never get playing sports. But you have ligaments that support your knee to hold everything in place so that you can continue to have integrity in the knee and you continue to flex extend. So you have one ligament on the inside, one on the outside, and you have one protecting anterior motion and one protecting posterior motion. And they all create like a nice little capsule there. So you can flex extend, but if that hip for a long period of time or for other reasons, maybe again, you're sitting at your desk all wonky, you like to sit with your leg crossed, then what'll happen is the muscles and the tendons and the tissue start to get really strained, in which case it loses its integrity a little bit. And then we could end up with an injury really easily. Where it may have taken quite a bit to have an injury in the knee, it might have been a lot easier if we're already compromising the integrity of the structures. So that's just something else to keep in mind. I'm gonna back up just a sec here. So now people, take a look at the gentleman on the right-hand side here, and you see how his knees are not in neutral. So look from his hip. I couldn't find a better picture of this, but look from his hip down to his knee. And then from his knee, he's got his knee tucked back and he's kind of on the ball of his foot here. So again, he's sitting all day like this, creating these contraction patterns for the entire day. Could you imagine? Hours upon hours. And then you think about all of the muscles that are in the back of his leg here, in the front of his leg through here, through his hip, and they're just holding and they're contracting throughout the whole day. And then he goes to stand up and he wants to walk around, but those muscles will stay tight potentially. And if that's the case, if these muscles stay tight through here, then they're going to cause a pull on other tissue. And this is your plantar fascia down here. So you have a tendon, oops, let me just back up. You have a tendon down here called your plantar fascia, can get irritated. Sometimes over long periods of time, people can develop spurs, bone spurs. And that can come from periods of time of having too much pressure bearing down into one section, lots of different reasons for bone spurs. But over time, this type of thing can happen if our body is not displacing its weight evenly, or if there's too much pressure one side to the other, or if muscles are pulling too tight, they might be pulling things out of alignment, and it can be quite painful. So those are all the reasons, guys. Those are the 5 main areas, which is pretty much our whole body, but those are the 5 main things that we end up seeing while we're sitting at our desks that might be perpetuating problems or pain. So again, if you want to chat with me about it, because we're about to do our yoga sequence, it's only going to be about 15 minutes, which is perfect because sometimes it's all we have at work is 15 minutes to do a quick stretch. So we'll make it short and sweet. If you'd like a copy of just the 15-minute sequence, please feel free to reach out to me. I'm actually going to upload this whole course here to YouTube so that you can jump on that if you want to see it again. Otherwise, if you want to chat with me about something specific and you want to do virtual, then you're more than welcome to jump on a virtual chat with me at any point. Just fire off an email, info@naturalalignments.com. And let's have a look. I think I see a question in the chat. What's a good way of treating carpal tunnel? Any exercises or suggestions to reduce pain in the wrists? Absolutely. I'm so glad you asked. So let's come back to that. I'll leave the chat open for when we finish. If anyone wants to talk after the yoga sequence, please feel free to jump into the chat and leave something there too. But when it comes to carpal tunnel, we think about what caused it. So quickly, I'll address that. So we come back to the anterior shoulder posture because we know that the median nerve, which was one of the bigger culprits for carpal tunnel, comes from the back of the neck, traverses down underneath the arm, right down into the fingers. So if we have this anterior posture or we have contraction at the elbow and through the wrist, then something we may want to do is help to, right from the root, help to open up the tissue and create range of motion in the joints so we don't have tissue that's creating compression on the joints. And also we want to really assess our workstation setup. We want to make sure that we're not sitting in a position where our wrists are not neutral. Instead, we want to really make sure we're in a position where our elbows and wrists are in alignment. So basically our bones are stacked, if that makes any sense. Okay, so if you have a yoga mat, please feel free to grab your mat now. Alrighty, and come onto your mat. If you're new to Zoom, please feel free to jump over to the sidebar where it says view. You can go to speaker view or gallery view. You might want to go to speaker view if you want to be able to see the yoga sequence in its entirety, but please feel free to join us onto the mat. And if you happen to have a block, this is something you may want to keep handy, is a yoga block. Keeping in mind, I mentioned earlier, 34 weeks pregnant. So the movements that I'm going to be showing you today are going to be very helpful for a lot of the areas we discussed, but they are pretty gentle movements. So we're not doing a fast-paced vinyasa flow. It's something that you would likely be able to do sitting at your desk. So let's come into a nice comfortable seat. If you are at your desk right now and you want to stay in your chair, you'll be able to do this entire sequence from your chair, with the exception of maybe one movement. But let's create a nice long spine. So coming back to our neck, our jaw, our shoulders, our wrists, and our elbows all the way down here. Let's think about our upper body first. We're going to create as much space as we can. We know that our neck is responsible for flexion. Our upper back is responsible for rotation, same with our neck, as well as side bending. So we're going to really focus on understanding how our body feels. This is what yoga is all about. Yoga is about assessing your body and feeling what you feel, and then coming to understand where we personally feel restriction and where we can make some change. So nice long spine. We're going to reach through the crown of the head towards the ceiling. Going to tuck our chin slightly. Good. Let's just take a few breaths here. Let's check that our hips are firmly rooted down into the chair or into the mat. Good. We're going to contract our core slightly. So pull your navel, your belly button, towards your pubic bone. So pulling in, creating a core contraction, lengthening through the crown of the head, tucking our chin slightly. Good. And our gaze can come down onto the floor. Deep breath in, lengthen through the crown of the head with the inhale. And as we exhale, root those sit bones down into the mat. Good. On the next inhalation, we're going to bring our gaze to where the ceiling meets the floor. Inhale, and as we exhale, now we're going to drop our chin all the way down towards our chest, towards our sternum. This is the bone in the center of our chest. Dropping our head down. See how that feels. We might feel pull right into our middle back. This is a good observation. Inhaling our head all the way back to neutral. And exhale, drop that chin all the way back down. And this time, rotating our chin towards our right shoulder. Lengthening through the entire side aspect of our neck. Good. From here, so keeping our chin facing towards our right shoulder, feel free to drop your right ear towards your right shoulder. And see if that allows you opening even more in the neck. And be mindful of the difference between pain and tension. So we want to stay where we feel tension. Good. This can be a little intense if we have any issues with our neck tension. Good. Inhale, we're going to roll that chin along our chest, all the way back to neutral. And then bring our head back up to gaze in front of us. Take a nice big breath in, lengthening through the crown of the head. And as we exhale, dropping our chin down, and we're going to rotate our chin towards our left shoulder. See how that feels for you. This may feel great. This might be enough. Otherwise, we can drop our left ear towards our left shoulder, opening up through the right lateral aspect of that neck. Good. If we need a little more, you can place your right hand down onto the mat. Inhaling, we're going to trace that chin all the way along to our sternum and bring our head all the way back to neutral. Good. Take a deep breath in. We're going to bring our hands behind our backs, pressing our sternum, that center chest bone, forward. Our gaze to where the ceiling meets the floor, or sorry, where the ceiling meets the wall. Ceiling and floor shouldn't meet. Okay, good. And press our chin forward. So now we're opening up. Remember, we spoke to the neurovasculature and through the anterior aspect of the shoulder. We're opening up. We're doing the opposite of what we do throughout the day. So we're opening up that anterior aspect of our shoulders. Good. Take a nice big inhale here. Let those ribs expand. And exhale, we'll come back to neutral. Good. As we inhale, let's bring our arms all the way up, pressing our elbows out to the side. Press your sternum forward. Big breath in. And as we exhale, drop our head down, clasp our hands, rounding through our upper back. Good. We can either do it this way, or as we inhale, if we enjoyed the previous one, we can bring our hands behind our back, press your sternum forward, big breath in. And then exhale, clasping our hands in front of us, dropping our head down, rounding through our upper back. Good. Inhale all the way back to neutral. And as we exhale, right hand on our outside of our left knee, bring our left hand behind our sit bone to create length through the crown of the head, and then rotate from our lower back first, all the way over our left shoulder, followed by our gaze over our left shoulder. So creating a nice big rotation. Good. Inhale all the way back through neutral. And as we exhale, left hand on the outside of our right knee, right hand at our lower back. Good. Or onto the floor behind our sit bones, lengthen through the crown of the head, and rotate from our lower back all the way over our right shoulder, followed by our gaze over our right shoulder. Good. Inhaling all the way back to neutral. So from this position, if we're sitting cross-legged right now, I invite you to either come onto your heels, sitting the way that I'm sitting, or into your chair, because I'd like to really hone in on what it is to move in a pelvic tilt. So coming back to your chair, I'm going to come to my chair, wherever you're most comfortable. We're going to sit up as straight as we can because we're coming into our lower back now. So let's just check the alignment of our chair. So we want our knees to be at 90 degrees to our hips. We want to check that our heels are in alignment with our knees. Good, nice long spine. We're going to keep our upper back as straight as we can. And from here, what I'd like you to do is place your hands on your hips. Good. On the inhalation, tip your hips forward. So if you'd like to, take your hand and you can feel your lower back come into extension. So coming into extension. So your upper back is nice and straight. It's just your hips that are pushing forward into extension. Good. As we exhale, we're going to do the opposite. We're going to scoop our sit bones down, our tailbone under. So keep your back nice and straight. And we're going to scoop just pelvic rock. We're going to posteriorize that pelvis. Good. Inhaling into your pelvic tilt. Exhaling, posterior pelvic tilt. So it's the pelvic rock. So we're keeping that upper back nice and straight. Envision like you have a teacup on top of your head. So we don't want to drop our head and shoulders down. We want all this motion to be coming specifically from our lower back. Good. Let's see if we can time those breaths. We'll do 2 more. On the inhalation into extension. On the exhalation, coming into flexion. This is a new motion for some of us, so it might take us a little bit of time to explore the range of motion here, which is wonderful still. Okay, and another thing we're gonna focus in on, and something for you to think about too if you're dealing with knee pain or ankle pain or foot pain like we were speaking to, some of that might be coming from your hip, so you might wanna spend a bit more time releasing your hips, but we're actually gonna land today with just a hip flexor stretch. As we're often sitting at our desks, we tend to create a lot of tension in the hip flexors. So let's come beside our chair, still appropriate to do at your desk, but we're gonna come into a lunge. So we're gonna bring our left foot forward, check that our left heel is in alignment with our left knee, good, and our right knee is on the ground, and our toenails are flat on the ground. Take a nice big inhale, you can place your left hand on your left knee, and then slowly come into a lunge. Now this is gonna allow you to open up the anterior aspect of your right hip, which is very helpful because as we were saying, these muscles, your psoas, your hip flexor muscles, are holding your trunk upright all day as you're sitting in a chair, or there are some of the bigger muscles that do that work. So we wanna release the tension they might be holding on to. If you wanna add another layer, please bring both hands up over your head. Good, pressing your chest forward. Big inhale. As we exhale, let's switch sides. Bring your left knee down onto the mat. Right foot can come up onto the mat into a low lunge. Take a big breath in here, and as we exhale, same idea. So left knee onto the mat, toenails firmly planted onto the mat, checking our right heels in alignment with our right knee. Right hand can come onto right knee, left hand on left hip. Big breath in. As we exhale, come into our lunge, opening up the entire anterior aspect of that left hip. Good. If you'd like to add a little more, feel free to sweep those arms right up over your head. Big inhale. And exhale. Good. All right, let's come back up into our chairs. We're gonna come back into a seated position. So this is a sequence that literally was 15 minutes and that you could do easily just sitting at your desk. And it focused on those key 5 areas that we wanted to focus on today. So that again was our jaw, our head and our neck, our shoulders, all the way down through our fingers, elbows, specific into our wrists, our hips, our lower back, as well as our knees and feet. So we really covered a lot of stuff today. If anyone has any questions at all, you can either feel free to throw them into the chat. I'd be happy to answer them, but also if you wanted to do a one-on-one with me, I'm very happy to do something virtually for you. Or if you wondered about your setup, if you're doing your best to kind of sit yourself in a position where you feel neutral, but you're not sure, again, I'm happy to do free assessments for you. So let me know if that's something that you would like, info@naturalalignments.com, or if you'd like to do an osteopathic assessment online. Again, we're doing free ones right now, so you're more than welcome to jump in and join that. And if you want just a copy of this sequence, then you can also reach out and I'd be happy to give you a copy of the sequence. So I hope you enjoyed today. And if you're in the area, whenever we're allowed back in, just come and say hi. We've been here since September, so we'd be so happy to meet you. Okay, guys, let's take a look at the chat. Okay, we're all set. Okay, thank you so much, everyone. We'll see you soon.